Hi, we are Dr. One, and this is Community Health Migrant Workers in Canada. Canada is known for its diverse culture and endless job opportunities for those who seek it, but a major labor shortage is currently happening in Canada's agricultural sector. This human resource sparsity can also be attributed to a decreasing rural population and an increased demand for natural food products. This critical issue may mean shortages of seasonal food products that are being grown and provided to the society. To balance this inequality in supply and demand, workers from developing countries are being recruited through programs such as the Seasonal Agricultural Work Program, bringing in tens of thousands of migrant workers hoping to financially support their families back home. As of January 31st, 2021, there were over 5,400 migrant workers in the country, with an expected increase to 50,000 individuals or more for the upcoming year. Surge of the COVID-19 pandemic, almost everyone's livelihood has been affected, and migrant workers are not an exemption. Despite the contribution of temporary foreign workers to the Canadian economy, the Government of Canada neglects their living conditions by not enforcing a standard housing requirement for workers. Some of these migrant workers were reportedly forced to live under overcrowded and unsanitary conditions, making communicable diseases such as COVID-19 to spread more easily. For example, it had been reported that nearly 1/5 of all Ontario farms are non-compliant to COVID-19 guidelines, and it was reported that a single farm in the province was responsible for 200 positive cases traced from its migrant workers. Research has also showed that in June 2020, 3 migrant workers from Mexico had died from COVID-19. The current pandemic aside, any disease outbreaks in these conditions can easily go out of hand and spread to the general population, putting a toll on healthcare and eventually on the government's finance sector. Therefore, developing healthy public policies that set a minimum standard for living conditions of migrant workers must be done, as they currently do not exist. Speaking up against unhealthy working conditions and substandard employer-provided housing typically leads to a loss of income for these workers. With policies in place, the government that they dutifully serve can now protect these workers from their employers' abusive power, preserving their right to a safe and healthy workplace. Reorienting health services toward disease prevention and health promotion is another way to address this issue. Migrant workers in rural communities are actively contributing to our country's workforce and therefore our economy. These people, like you and I, are entitled to sanitary living spaces with all basic amenities while performing physically and mentally strenuous labor in a country miles away from their loved ones.